normal B cells are designed to adapt to insults from the outside. So by that I mean they are designed to develop mutations in their antibody genes that allow those genes to become better at interacting with and latching on to whatever that insult might be, whether it be a virus like SARS, novel SARS-CoV virus, or a bacteria like strep. So this is a normal process that takes place in B cells, and it's the only cell in the body that we're aware of that has this capacity. So it intentionally changes its genes to adapt to what the environment is exposing or invading the patient. The mechanism by where that happens is that a enzyme called activation-induced cytidine deaminase, or AID, is upregulated, and that's the enzyme that starts this mutation process in normal B cells. So we and others over the years have looked at the action of this enzyme AID on leukemic B cells, CLL B cells, and have been able to document that indeed the enzyme is made, especially in B cells that are dividing or have recently divided, and that the enzyme can be active in that it can actually make changes in the antibody binding site. Unfortunately, in CLL and in other cancers, the enzyme can also act at sites that are not just the antigen binding site, but sites throughout the human genome. So one of the ways that CLL and other cancers are progress, and maybe even initiate, though at least progress, is by this enzyme inducing new changes throughout the human genome. And those changes some of those changes are benign and others can be malignant. And those that are more malignant allow for the tumor to grow better. So recently we studied the effects of this enzyme on the antibody genes of the CLL clone, focusing on new changes in the antibody clone after the transformation event. So these are post-transformation mutations in the antibody genes mediated, we thought, at least initially, by AID. This is the work of Davide Bagnara, who is now in Genoa, Italy. And what Dr. Bagnara found was these new mutations that occur in the antibody genes have different characteristics than those that are normally induced by the enzyme AID. This is a very surprising result to us and implies that at least after transformation, that is, after a B cell becomes a CLL cell, that the mechanisms whereby mutation occurs are either mechanisms that are mediated by AID, but for some reason or other are not behaving the way that AID would in the normal sense, or are made by a mechanism that's distinct from AID and actually has characteristics that are almost the opposite of AID. So we believe that this is something that should be followed up on to see whether or not there are other ways in which CLL cells and maybe normal B cells and other types of B cell leukemias and lymphomas can diversify and lead to disease progression.